Good morning. It's July 17th, and this is your daily brief in science. Here's everything you need to know. Lipfendra, Merck's first non-injectable pill, has been approved by the Food and Drug Administration to lower low-density lipoprotein cholesterol in high-risk patients who remain above goal despite statin therapy. In clinical trials, low-density lipoprotein reductions were substantial, with roughly a 55% drop after 6 months in one study and about a 59% drop in another, with effects persisting modestly over a year. The approval comes as cardiovascular disease remains the leading cause of death in the United States, underscoring the ongoing effort to lower low-density lipoprotein cholesterol to reduce risk. Lipfendra is priced at $10.50 per day, and insurance coverage varies by plan, raising questions about access. Some patients may pay cash or use platforms like GoodRx, Cost Plus Drugs, or Amazon to reduce out-of-pocket costs, while Merck also offers direct programs or government or manufacturer assistance. In trials, the pill must be taken on an empty stomach and cause dizziness and diarrhea at rates similar to placebo, with the overall safety profile largely comparable to placebo for those with inherited high cholesterol. The drug adds an oral option to a cholesterol toolkit that has been historically dominated by injectable proprotein convertase subtilisin/kexin type 9 inhibitors. Merck aims to diversify its portfolio beyond Keytruda as patent cliffs approach in 2028, which could affect competition in its oncology lineup. Lipfendra is expected to hit pharmacies in the coming weeks, and how insurance coverage plays out will likely shape out-of-pocket costs for patients. The story is part of ongoing coverage as scientific journalism notes the development and invites reader engagement while acknowledging the possibility of updates. A landmark observation confirms an atmosphere on rocky exoplanet LHS 1140b, including evidence that helium is escaping from the planet's upper layers based on 2024 transits with the Magellan Clay Telescope. This finding shows rocky worlds orbiting dwarf stars can retain atmospheres, a crucial factor in evaluating habitability, potential liquid water, and biosignature prospects. LHS 1140b, about 48 light-years away, is identified as Earth-like in habitability terms, with potential for liquid water and a protective atmosphere, making it a leading target for astrobiology. Unpublished JWST data could help determine the atmosphere's bulk composition and size, clarifying habitability prospects. Planned JWST follow-ups aim to quantify atmospheric composition, including helium abundance and other molecules, to confirm the atmosphere. Models and observations point to a helium component in the atmosphere, suggesting a broader envelope that could include CO2, Colorado, trace O2, and substantial water. Future work will test predictions on other exoplanets and refine understanding of helium-rich atmospheres, with ongoing research under NASA Hubble Fellow involvement. Current results are under scrutiny for potential stellar signals, with multi-instrument observations planned to confirm atmospheric presence and composition. LHS 1140b has likely retained its atmosphere for over 3 billion years and could persist for about another billion, possibly hosting heavier gases like CO2 or N2. The planet is roughly 5.6 times Earth's mass and 1.73 times Earth's radius, compatible with an Earth-like composition with a gaseous envelope or possible global ocean. Experts caution that while atmospheric and water habitable indicators are promising, direct evidence for life remains unresolved, and findings relate to atmosphere and habitability indicators rather than biosignatures. The team's model predicted a helium-dominated escaping layer, a hypothesis later supported by observations, implying a detectable atmosphere that could persist with replenishment. A new set of dementia risk reduction guidelines from the World Health Organization places a sharper focus on actions you can take now. Up to 45% of dementia risk could be prevented or delayed by addressing lifestyle and health factors such as tobacco and alcohol use, social isolation, physical inactivity, air pollution, and non-communicable diseases like hypertension and diabetes. Physical activity sits at the center of prevention, strongly recommended for adults with normal cognition and conditionally recommended for those with mild cognitive impairment, emphasizing endurance, strength training, and reduced sedentary time. Public health strategies and personal measures highlighted include a healthy diet, non-smoking, physical activity, and cognitive engagement to lower dementia risk. Among midlife factors, hearing loss and high LDL cholesterol each account for about 7% of dementia cases, while lower education in early life and social isolation in later life contribute about 5% each. Cognitive training and cognitive stimulation, reading, storytelling, and everyday tasks, are endorsed, though with low to conditional evidence given a limited evidence base. Two new factors added to the risk factor list in 2024 are high LDL cholesterol and vision loss, expanding the 2020 framework. The guidance cautions that these guidelines are not a substitute for clinical advice and that evidence quality varies. Prevention should address brain, heart, and environmental health across multiple domains. Managing cardiovascular risk factors, blood pressure, diabetes, and high cholesterol, and considering hearing aids for hearing loss are emphasized as part of risk reduction. Hearing aids are recognized as potentially protective against cognitive decline for people with hearing loss, and social engagement is explicitly recommended, marking a shift from earlier years when evidence for social activity was weaker. Improved air quality and lower particulate matter indoors and outdoors are linked to cognitive benefits, while vitamin and dietary supplements are not advised for dementia prevention unless there is a diagnosed deficiency due to insufficient evidence of benefit. Researchers slowed aging effects in mice by deleting EP2 specifically in tissue-resident macrophages, which preserved young neutrophil clearance and reduced senescent neutrophil buildup across multiple organs. The change improved function in the brain, heart, skeletal muscle, liver, kidney, and gut, and also slowed cognitive decline with a shift toward youthful inflammatory and protein signatures, notably impacting liver-related pathways. In older mice lacking macrophage EP2, inflammation decreased, cognitive performance improved especially in the hippocampus, visceral fat reduced, muscle mass preserved, and 59 of 71 age-related proteins retained a more youthful profile. Clinically, broad PGE2 suppression by non-steroidal anti-inflammatory drugs can cause adverse effects, highlighting the potential value of targeted EP2 therapies. Future work will explore whether EP2 blockade can influence the onset of age-related conditions, including Alzheimer's disease, in humans. A Stanford Science article summarizes the research and notes translational potential along with supporting human data. Safety remains a concern because EP2 participates in normal signaling, so systemic blockade could have unwanted effects, making macrophage-targeted aging therapies potentially safer. Therapeutically, the work suggests developing a highly selective EP2 inhibitor to restore macrophage phagocytosis without broadly suppressing prostaglandin signaling as an anti-aging approach. Human data from large liver datasets show parallel age-related patterns, more senescent neutrophils, reduced macrophage function, and higher EP2 activity, supporting translational relevance, though correlation does not prove causation. The study was conducted at Wutsai Neurosciences Institute with Stanford medicine researchers led by Katrin Andreasen, funded by NIH, AHA, Knight Initiative for Brain Resilience, Arc Institute, Chan Zuckerberg BioHub, and a German collaborator with findings published in Science. The Aral Sea's drying has shifted from a long-standing carbon sink to a carbon source, releasing about 748 million metric tons of CO2 between 1960 and 2022. As the lakebed exposed, carbon stored in sediments was released to the atmosphere, amplifying climate impact and illustrating the dynamic carbon balance of drying inland waters. Researchers estimate roughly half of the emissions occurred in the first 15 years after exposure, with wind-blown sediment contributing about a fifth of the total CO2 releases. Experts say practical fixes would require cross-border water management and could leverage carbon credit mechanisms to incentivize restoration or conservation. The study points to climate benefits from restoring or reframing management of drying lakes, though aligning water rights and infrastructure across borders is complex. Scientists warn that drying lakes may represent climate tipping points, with emissions potentially driving warming more aggressively unless mitigated or reversed. The urgency to research practical pathways forward is underscored by the risk that these dry flux emissions could dominate future climate forcing. Limitations exist due to shallow sediment sampling, up to 50 centimeters. Researchers plan deeper drilling next year to better quantify carbon dynamics and note potential underestimation from deeper layers. Uncertainty remains because current estimates depend on limited core depth, with deeper layers potentially altering past and future emission figures. There remains about 605 million metric tons of carbon still in the basin, which could be kept in the ground and valued at roughly $18 billion in carbon credits, presenting an incentive framework for conservation. Keeping substantial carbon in the ground could create economic incentives, including carbon credits around $18 billion, to support mitigation or restoration efforts. The Aral Sea, once the world's fourth largest inland body of water, has largely dried up due to Soviet-era irrigation for cotton, leaving a vast salt flat and triggering ecological and humanitarian crises. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. We'll be back Monday with everything you need to know.